Hi, welcome to Navigating the Way for Seniors. My name is Tabitha Tripp. I'm the owner of Tender Hearts Home Health Care. I want to welcome Peter Ham today. Hi, Peter.
Hey, hi, Tabitha.
It's nice to have you.
A pleasure to be here as well.
Peter Ham is a licensed mental health counselor. He's been one for 26 years. He's also an active participant in the Alzheimer's Association Partnership, and he is presently an Alzheimer's consultant, featured speaker, and director of operations of the Professional Counseling Center in New Bedford. Quite impressive, Peter. Well, I know you are so involved in the Alzheimer's Association and just, becoming an advocate for speaking on the topic. And years ago, I know that years ago, people that had memory problems, they kind of dumped it into a category of saying that they were senile.
Yep.
And it seems like now they've kind of refocused and they've named it dementia. And people just don't seem to know the difference between dementia and Alzheimer's.
Yeah, unfortunately, people throw that term around quite a bit. A lot of times, if people get a thoughtful diagnosis, Alzheimer's is a thoughtful diagnosis that has to start with your primary care physician to make sure that you're ruling out something that may be causing some of the memory problems. Because there's a whole host of health issues that can mask itself as though it were Alzheimer's that could be reversible. And so a good trip to your primary care physician and expressing some concerns that you have. But I think you're raising a good question that a lot of people just believe that because there's memory problems it's associated with older age. And it's really important that people realize that Alzheimer's is an abnormal part of the aging process. It is not a normal part of the process. In fact, probably most people don't realize it, that probably only 4% of the general population ever find their way into extended care facilities. Whereas you look at some of the media, people believe that that's not the case. So,
right. So normal aging in place. I mean, seniors, they have memory problems. I mean, we all do.
Yep.
And then when you go to the doctor, and I know that some seniors, they walk out of there and the doctor said, yeah, you just have like a mild case of dementia.
Yeah.
They walk out thinking that, oh, that's not too bad, but they don't realize.
Yeah, that's, I really take those things seriously. It's much like someone saying, well, by the way, you have blindness. You want to know why you're going blind, much like if you have a form of dementia, you want to know what the cause is. So I would really push when people hear that word dementia, what it actually means is that there's been brain damage, and as a result, the brain isn't functioning as efficiently as well as it could be. But I would encourage people, when you hear the word dementia, just ask why. What has caused the brain damage?
So with dementia, there might be some medical things that they can be reversed, but if they say it is Alzheimer's, it's not reversible. Am I correct in assuming that?
They are, but and I'd qualify to make sure that just that you go to one particular person and then they immediately assume that it's Alzheimer's. They really need to go through a thoughtful, normal testing, the blood tests. They'll do some neurological assessments. Sometime your primary care physician may actually have you go see a specialist just to make sure that they're not missing anything. Alzheimer's is a last resort diagnosis after they've ruled out all other sorts of things. What's unfortunate, particularly, we're coming off the warmer months, although you wouldn't know it now. People that are dehydrated can come across as being confused, a little forgetful, and if someone is living by themselves and are not remembering to drink adequately, they're just simply dehydrated and yet can come across as though that they may be, quote-unquote, suffering from a memory problem. And similarly with thyroid problems, a lot of cardiac medications are some things that unless they're being thoughtfully followed by their physician, these are some things that people can believe that there may be, quote-unquote, a dementia, when indeed all it is a reversible medical condition.
Okay. Okay, so let's assume the diagnosis has been made,
okay,
and somebody does have Alzheimer's. Let me just back up and tell you something very interesting.
Sure.
A few years ago, I did a class for my caregivers, and I also opened it up to anybody, public, Marion, that wanted to come. And the class had been started, and I'm sitting in the front, and I noticed that an older woman and her son walked in as we were already starting, and they sat in the back. So I figured during the break, I'll go over and introduce myself. And my first assumption was, Dad has Alzheimer's. And when I introduced myself, and come to find out, she was diagnosed with Alzheimer's.
Yeah.
And she wanted to find out as much as she could
Yeah.
of what's going to... I was so impressed with that.
Yeah.
And I think people need to be educated. So if somebody gets that diagnosis, whether it's the person themselves or the family member, what's the next step that that needs to be taken care of?
You know, a lot of people think, you know, well, what can you do? And I'm going to just put the question right back is, you know, by and large, people that have been formally diagnosed, generally speaking, usually there's a whole host of other things going on with their body, but usually 8 to 10 years. Why would you want to wait to find out that you have a terminal illness that is irreversible?
Right.
Why? And just as you're suggesting there, once you get appropriately diagnosed, there's a whole host of things that, one, you can be making some thoughtful decisions while you're able to do so. You can be letting your family members, friends, your employers be aware that something's going on, and you can make some thoughtful steps in terms of transitioning into possibly retirement if you're still working. But there's no reason why a person should stop being productive. Our society, you know, just because someone gets diagnosed with Alzheimer's does not mean that they lose their ability to be productive. And that's something where our society struggles with. Just because someone does have a life-altering diagnosis, there are thoughtful ways and strategies that families can learn on how to relate to their loved one or with their employee or employer in a different way that people hadn't done before.
So you definitely want to let everybody around you know.
Well, that's, you know, you raise kind of a thoughtful question, and one of the things that I always, I run an early stage group for people just recently diagnosed, and that's kind of a decision that the individual and their, sometimes their spouse or the person who they're most comfortable with, to make that decision. And I always try to qualify, you know, everyone. It's hard to kind of put everyone in the same situation. People are making the best decision that they know how, but I encourage them to think about that. Why wouldn't you want to let people know? In fact, most of the folks that I work with, they're actually relieved that they have got a diagnosis that explains why they've been doing, why they've been thinking some of the things. They now have a common enemy to blame. It's not them just quote unquote, and I hear this a lot, oh thank goodness, I thought I was just going crazy.
Yeah.
No, you have a medical diagnosis that is causing your brain to slowly deteriorate, that's causing you to do these things.
So in one of these support groups that you do, what are some of the suggestions that you give them?
Well,
like say early stages, and I know that you don't like to talk in terms of stages.
Yeah, well, and that's one of the things, and thanks for bringing that up, Tabitha. A lot of times people are trying to anticipate what's going on, and I try to just remind people, you know, our bodies are all different. And we, more often than not, people have more than one thing going on at a time that kind of causes the disease to progress at a different rate sometimes. And I usually try to say, you know, when people are trying to focus in on what level or what stage is the person at, you know, let's stay focused in on what is the person doing right now. What are they able to do? Yes, I can appreciate the thoughts of trying to think ahead as to what else we need to be thinking about. But sometimes we lose track of the individual when we're trying to think too far ahead. And that's sometimes why I really, you know, caution people that don't let the stages run away from the person that's right in front of you.
Yeah, I like that. Can you repeat that?
Sure. I wouldn't, you know, don't let the stages, you know, distract you away from the person that's right in front of you.
I like that.
Yeah, people get too caught up in that, and let's face it, our society really doesn't know how to combat this. In the United States, there are 14 states that have actually passed a state Alzheimer's plan, which means it's a central organization within the state that is going to administer how we're going to handle this incredible illness that's going to crush our health care system. 14 states in the United States already have a formal plan. Massachusetts is one of 7 that are in the process of formalizing it.
What exactly is that?
Well, it means that they're linking the Office of Elder Affairs, it's linking hospital groups, it's going to help streamline it, that if people are looking for resources, that they're going to be able to help people get better diagnosed, let them know where they should go, resources for physicians, resources for educators, for people that are providing some good research. It's really raising it to the forefront. I'll give you sort of an interesting example. The Social Security Administration just recently listed early onset Alzheimer's as now as a disability.
Oh, wow.
For people that were suffering or have been diagnosed with Alzheimer's prior to the age of 65, it took them 2 to 3 years to get access to their disability benefits. Now it's a fast-track diagnosis. You've got to get diagnosed appropriately, but now people can get access to the disability benefits much quicker. And it all has to do with the federal government recognizing that this is a significant issue and is charging each state to come up with their own plan on how they're going to help individuals and their families. And quite frankly, I'd expand that to say help business and industries on how we're going to be combating this insipid illness that right now, in just 1 year, it's gone up from 5.2 million people in the United States to 5.4. In just 40 years, that number is going to more than double.
Of those that are going to have Alzheimer's.
That's correct. And sort of the surprising number out of that 5.4 million people that currently have been diagnosed with Alzheimer's, a significant number of them, pretty close to 1 million, are under the age of 65.
Wow.
So if you take that figure is going to more than double in just 40 years. Thank you for inviting me. I did a little bit of interesting research. This is the one thing that kind of, I think, is what's gotten the federal government and the states really hyped up, that in the next 40 years, Alzheimer's is going to cost the American society $20 trillion. That's including $15 trillion to Medicare and Medicaid. That's an unbelievable number when you're thinking about it. All the other major illnesses have actually, their death rates have decreased in the last 10 years. These are diseases from breast cancer, prostate cancer, heart disease, stroke, and HIV.
And they've decreased.
The instances of death, and a lot of that was raised public awareness. Some thoughtful funding has gone into that whole research and made some wonderful gains in terms of people, particularly heart disease is one of the big diseases that have led to people dying, but some good education in terms of people's diet, exercise.
Plus, with diseases like that, there are more ways to cure where there isn't for Alzheimer's.
Right.
And Alzheimer's also, you can't really diagnose that 100% until after they're gone. Is that correct?
We've actually gotten much better, though, in a lot of the clinical settings where you're getting an opportunity to be able to look at the person not only from a social history, believe it or not. That's probably one of the biggest helpful tools to a clinician. But they've got some neurologists that will take some special imagery of your brain to, again, they're trying to rule out something that may be reversible or may be causing the signs and symptoms. But it's something that's really going to crush society, and I'm not so sure that we really need to talk about it. And it's something that some of the notable figures in the United States, thankfully, Charlton Heston was one who was very thoughtful in coming out and making it known. And as we know, former President Reagan was the one to come out and let people know. Glenn Campbell just recently has been notable. For those people that are the Jimmy Buffett fans, Jimmy Buffett's dad passed away from Alzheimer's not too long ago. But just the sheer numbers are really going to, unless our state and our country has just recognized, they've passed the National Alzheimer's Project Act to empower the states to develop agencies to help streamline and provide resources to professionals, families, employers on what we need to do to combat this. Right.
So somebody that's been diagnosed, what is some of the, before being diagnosed, what are some of the things that families, key issues that they really need to look for that is not just aging in place?
Right, yeah, and that's, and some of this will be, people will kind of take a deep breath and go, thank goodness. But some of the things that really seems to hit home is usually it's the checkbook and managing finances. And it's not so much that the person misses a bill. Let's say that they used to always balance their checkbook, but now suddenly can't balance their checkbooks and are changing their accounts to different bank because, you know, that darn bank can't get it right. And you know what, I'm just going to take my money out and I'm going to put it somewhere else. Mm-hmm. When this person has been very fastidious about their accounts and now suddenly is no longer able to manage their accounts in a thoughtful way, I usually find that's usually a trigger. Now, if the person is by themselves managing their money, usually the bank tellers are the ones that can notice that something may be going on. But again, people feel a little awkward in not saying anything because, you know, they just don't want to.
Yeah.
But bank accounts is a good thing. It's one thing, some people say, and this is sort of an analogy I usually use, is that when someone holds up some car keys, a person that's suffering from Alzheimer's will look at the car keys and not know what they're used for. Now, you and I may say, okay, where the heck did I put my car keys?
Right.
You know, every now and then, you know, we misplace things. We may not know how to set the VCR or the DVR onto our television sets, but when I lose track of a conversation midstream, or when I'm involved in a conversation with other people and I just get completely lost, it's not so much that the person is having a hard time finding a word, it's that they're getting completely lost in the conversation and not know where they are. I go back to the key analogy. It just shows it's more global, that I don't recognize what that key is for.
I can hear you on that. We had a client one time. He was a little Italian man, and every Wednesday was spaghetti day, so he had spaghetti and meatballs, and when you're Italian, I guess you twirl. You have your spoon. You know, most people cut it up or they slurp,
No,
the Italian, you twirl it
Yeah.
on a spoon. And we had this man for like a couple of years, and every Wednesday he would twirl his spaghetti on the spoon. There was this one day, this just goes from one week to the next. He ate the meatballs, and he sat there, the caregiver was next to him, and he sat there and he stared at his plate, and he didn't pick up that spoon,
Sure.
and he did not know how to eat that spaghetti.
Yeah. It's
She actually had to cut it up,
yeah.
and he ate it.
Right.
But he didn't have that knowledge all of a sudden. All those years, he's always used the spoon.
It's you know, you're raising a lot of times people wait for a lot of the symptoms to show themselves in ways that from their normal activities of daily living that they can't do anymore. And kind of the initial question you ask is when people are questioning that there's been some changes in their normal routines that they can't do, I would highly encourage people to ask, how come?
Yeah.
You know, why would you want to wait?
Right.
You know,
Right.
and I know there's that tension that if I don't ask about it, therefore it won't happen. It doesn't work that way.
Yeah.
It's,
And that tension, too, trickles down right onto the family members,
Sure
too, that
does.
are in the
Yeah.
home. So let's just chat about that for a few minutes.
Absolutely.
The dynamics of what's going to affect not just the person that's been diagnosed with the Alzheimer's, but now you're dealing with the spouse,
Sure.
the children
Yep.
that are now becoming the parents.
Yep.
So what are some of the issues, some of the answers that you can maybe provide for
Well, a lot
what
of-
they need to do?
Yeah, one of the things that's always important to find out kind of what's going on in their own home situation. The one thing I always really encourage individuals and their families is to find out what are their support systems, what are the things that are there to help as they move forward on the illness. You know, our society's great about diagnosing, but then they walk away. And it's like, you know, families say, you know, gee, my next appointment is in, you know, X number of months, but what do I do in the meantime?
Right.
If someone's involved in their faith community, you know, it's important for the faith community to be aware of this is going on, and then learning different ways to connect with a person. A number of professionals that have been diagnosed with that illness that I've had the pleasure of working with suddenly took up different things they'd never thought they could do. One gentleman had never painted before and found great comfort in doing that. Now again, we're not looking at how the end product, but just the process of being productive and doing something that's admired and appreciated that he then could hand on to a family member. that productiveness is really important. And regardless of how far along a person is progressed, we need to constantly find out how can that person be bolstered up where they feel productive, that they don't feel inadequate, that there are still things that they can do in spite of the fact that this illness is preventing them from doing things that they normally would be doing. So, back to your question, first of all, they need to, call. Probably the best resource would be the Alzheimer's Association. They have an 800 number, 24 hours a day, 7 days a week.
What is that number? Can you give that to us, Peter?
It's, I'm going to 1-800-272-3900.
Okay, that's the Alzheimer's Association.
Yep, and that's 24 hours a day, 7 days a week. And they also have a website that's just packed with information. But the one thing they encourage people is to call, because then they can link people up with some thoughtful resources. If you're going into a storm, why wouldn't you want to arm yourself with some thoughtful supplies along for the trip?
Right.
Why would you just want to be bouncing around out there in the sea without surrounding yourself with your thoughtful supplies? And that's one of the things that the Alzheimer's Association can do. They can call and ask for a care consultation, which for most families that I encourage them to call the association, it's a free consultation. They can link multiple family members on the same call to try to map out some sort of an idea as to what they might want to be doing. There's a whole host of educational seminars that are around throughout the state that are on different topics that families and even the individual with Alzheimer's is able to take advantage of.
So definitely, educating yourself and getting support is huge.
It's I still go back to education is the first step in tackling any war, and literally we're at war with this illness that's robbing our loved ones of their illness, and we need to arm ourselves ahead of time.
Yeah, that's what. Like, I was so impressed with that woman that came in to find out what the process that she's going to go through, and she wanted answers.
Well, and there's some those folks that just take the bull by the horns and just say, you know what, and I want to get these things set up so my loved ones don't have to worry about these things. I mean, what a wonderful gift if you think about it, that allowing the person that opportunity to map out things for them and to embrace family or friends to help them along, because whether we want to realize it or not, the person that's been diagnosed with Alzheimer's is our guide. They're the ones that we're following in this, and we do need to help them along the way. But in a lot of instances, they actually help us.
Yeah. So, summing things up before we end, what are some of the key things that you really want to tell somebody? Well,
first of all, if you're having some concerns that there's been changes in a person's daily activity living, that if they're driving, they're getting lost, they don't know where they're at, that's been different, that they're balancing the checkbook, their finances seems to be something is awry there. I'd encourage people to really go to their primary care physicians and be articulate about what they feel is going on. And then I would also encourage them to get in touch with the Alzheimer's Association, call that 800 number, and ask for some further information and other ways that they can arm themselves with thoughtful information so they can help them and then their loved ones out on how to maneuver this illness.
Very good. Well, Peter, thank you so much.
It's a pleasure.
Was so excited to have you on the show. And also, the Senior Resource Association is going to be hosting an Alzheimer's, dementia issues, and behavioral management session. Dr. Ricardo Barrero will be speaking, and Peter Ham will be there also speaking, and we're really looking forward to that. And at the end of our show, they will come up on the screen, the information. It's going to be on Monday, October 17th. It'll be at the Atria in Fairhaven from 5 o'clock to 6:30. And there'll be a phone number also at the end of the show on the screen, 508-994-9238. You can call that number to register. I want to thank you so much for coming, Peter. It was a pleasure. And I'll see you in October.
Yep, absolutely.
All right. Thank you so much for joining us.